Everyone, welcome to Get My Class. Today we're going to solve this question, which is surgical removal of uterus is known as dash. Option A, hysterectomy. Option B, vasectomy. Option C, tubectomy. Option D, all of this. So let us understand the question. It says surgical removal of uterus. Okay, what is that called as? Okay, so what do you mean by uterus first of all? Uterus is the female reproductive part. Okay, or you can say it is female reproductive part where actually the baby grows. Okay, reproductive part. So usually when there is an infection or during cancer, okay, cancer of the uterus or infection, severe infection, which can spread if the uterus is not removed, or even sometimes birth control can be done by the removal of the uterus as well. Okay, even as a birth control method, but it is very rare because there are various other methods to perform or to have birth control. Okay, but mainly during cancer or infection or any other disease, where the uterus the contribution of presence of uterus may lead to the death of the person. In that case, uterus will be removed. So the removal of uterus is called as hysterectomy. So what is removal of uterus called as? Uterus is called as hysterectomy. Okay, hysterectomy. That is what is removal of uterus. So let us see, the surgical removal of uterus is called as hysterectomy. As I told you, yes, that is the correct answer. But what do you mean by vasectomy? Vasectomy is nothing but a kind of sterility or if it's a birth control method by which there is surgery which is done on the vas efferents of the male reproductive part. It is cut and it is tied up so as to avoid the entrance of the sperm into the urinary tract and further into the penis, so that it will not be released in the females. Okay, so to avoid that, that is why vasectomy is done, and this is done in case of males. So here they are talking about the uterus of the female, hence it is known. Option C says tubectomy. Tubectomy, it is nothing but the surgical cutting and tying up of the fallopian tube in case of the female. Okay, so it is not removal of the uterus, hence it is ruled out. So option D is all of this, which is again ruled out because we have only one answer, that is option A. So let us conclude the answer. What is the answer? Answer is option A, that is hysterectomy. That is nothing but surgical removal of uterus. I hope you understood the explanation. Thank you, everyone.